Hello and welcome to another session of Facebook Live. Today's session will be on stereotactic ablative radiotherapy, commonly known as SBRT. And to discuss this, we had with us Dr. Harjot Kaur, consultant radiation oncologist and brachytherapy specialist at American Oncology Institute, Hyderabad. Good evening, doctor. So before we start with the questions, I would request you to give our viewers a glimpse of your expertise.
Good evening, everybody. I'm Dr. Harjot. I'm working as a consultant radiation oncologist and brachytherapy expert in American Oncology Institute, Hyderabad. I have extensive experience in treating patients on radiation machine with advanced radiotherapy techniques and performing advanced brachytherapy procedures for all sites in the body.
So coming to the questions, doctor, the first question is, what is SBRT? How is it different from traditional radiotherapy treatment?
So SBRT is a very specific advanced form of radiotherapy, which is defined as stereotactic body radiotherapy. And how it is different from any normal radiation is that it is a very accurate localized form of radiation, which is given by highly specialized techniques and the use of coordinates through which we can accurately localize the target. And we give a very high dose of radiation in a very short span of time. So it is a very effective technique for curing radiation-based tumors.
So the next question is, doctor, what are the different types of cancer being treated using SBRT?
So previously, the indications for SBRT were very limited. We used to treat only the lung tumors and liver tumors with SBRT. But in the past few years, there have been a lot of publications and research on this technique. And now we are using SBRT for a variety of indications starting from head to toe. We are using SBRT for lung lesions. We are using it for liver lesions. We are using it for spine metastasis. We are even using it for sites like prostate, head and neck, pancreas. So SBRT is being used in more and more sites as the research is advancing, as it is proving to be more effective than normal radiotherapy techniques.
So the next question is, doctor, what are the different machines being used to deliver SBRT?
So it is not possible to deliver SBRT using any normal radiotherapy machine. We need a very sophisticated advanced machine which can perform the task of delivering SBRT. There are certain technical specifications which depend from site to site. Basically, it should be an advanced machine and we need to visualize the tumor precisely in order to deliver SBRT.
So my next question is, doctor, what are the benefits of SBRT?
As compared to normal radiation, like I said, SBRT delivers a very high dose of radiation in a very short span of time. So normally radiation is delivered over a period of 4 to 6 weeks when the patient has to come daily from Monday to Friday every week for 25 to 30 sessions. But in SBRT, it is not like that. For SBRT, we usually finish the treatment ranging from 1 session to 5 sessions or maximum 8 to 10 sessions. So the treatment is shorter, and because we finish the entire treatment in a very short span of time, we give a very high dose of radiation daily so as to give the same dose. And because we are able to precisely locate the target, we are able to do it without causing any toxicity.
Next question, doctor, how is the patient prepared before the SBRT procedure?
So the preparation of the patient depends on what site we are treating, be it lung, liver, head and neck, prostate. In general, before we do an SBRT, it is important for us to do an imaging so that we can visualize the tumor correctly. It can be in the form of CT scan or MRI scan. And we also need to use something called as motion management when we do SBRT. Because most of the tumors that we treat with SBRT are mobile tumors. So when a patient breathes, the lung moves. When a patient breathes, the liver moves. And also sites like prostate, when there is bladder filling, rectum filling, the prostate can move. So we have to take care of the movement of the tumor so that we do not miss the tumor or we do not give a high dose to any other structure other than the tumor. So we do certain things like breath hold, motion management, abdominal compression, or gating. Gating is when we visualize the motion of the tumor during treatment and we place the beam so that the radiation is given only when the tumor is within the radiation field and not outside the radiation field. So all these things we have to take care of when we are delivering SBRT.
So the next question is, doctor, what is the treatment process of SBRT?
So after we prepare the patient, we understand the motion of the tumor. We call the patient for treatment, and then once we place the patient on the treatment machine, we use some immobilization devices which can be in the form of masks or backlocks so that the patient does not move during treatment. And we also monitor the motion of the tumor during treatment, which can be in the form of 4D or motion or gating sensors. We have certain sensors with which we can see the motion of the target. We can also place something called as a fiducian, which will help us track the movement of the patient's body and the movement of the tumor if we are treating lung or prostate or liver. And then we visualize the patient and the tumor during treatment, and then we deliver radiation in a very short span of time and a very high dose of radiation by precisely locating the tumor according to the coordinates that we have planned during our planning session.
What are the possible side effects of SBRT?
So like any form of radiation, SBRT also has few side effects, but in general, the side effects of SBRT are lesser as compared to any normal form of radiation if it is delivered properly. So if you are able to precisely localize the target, the side effects are minimal and acceptable, and they can be managed conservatively. And the side effects depend upon site to site. Now, supposing we are irradiating the lung, the side effects can be in the form of pneumonitis, cough, chest pain, but they are all very rare side effects. If we are irradiating a tumor in the pelvis, the patient can have some burning sensation while passing urine, burning sensation while passing stools, maybe mild abdominal pain, but all these side effects are temporary and they go off with time.
To the next question, doctor. Does treatment with SBRT hurt?
No. So this is a common misconception that treatment with any form of radiation is very painful. Radiation treatment delivery is just delivery in the form of X-rays, be it SBRT or any other form of radiation. So X-rays do not hurt. They are not visible. We just have to place the patient on a treatment machine. The treatment goes on for 10 to 15 minutes at the max, and the patient does not feel anything because these rays are invisible X-rays. So it does not hurt at all.
Coming to the next question, doctor. How successful is SBRT for cancer treatment?
Like I said, SBRT is a new technique with a lot of advancements in the past 2 years. If we see the data that compares SBRT with any normal form of radiation, SBRT has proven to be more effective in almost all the sites. Now, SBRT is being increasingly used as an option to treat lung tumors as opposed to surgery if the patient is not fit for surgery. And we can give equal cure rates with SBRT as compared to surgery. And if you deliver normal radiation, the control rates are inferior. So SBRT is much superior to normal radiation in certain specific tumors if they meet the criteria for delivering SBRT. And it has proven to have acceptable local controls, which is equivalent to surgery in most of the cases.
To my last question, doctor, for the day. Is there a chance of recurrence of cancer after SBRT? Is follow-up required after SBRT?
So cancer can recur after any treatment, be it SBRT, radiation, surgery or chemotherapy. It does not depend whether the patient has received SBRT or any other form of radiation. But SBRT is relatively more effective. It has higher local control rates and it can reduce the progression of the disease for a longer period of time. Also, follow-up is required after any treatment because cancer can recur, and if we catch the cancer recurrence early, we would be able to treat the cancer more effectively in future. One more word I would like to say about recurrent tumors. So most of the times when a patient recurs after previous radiation, SBRT is more effective and is the treatment of choice as opposed to normal radiation because it has lesser side effects and is more precise.
Thank you, doctor, for your valuable time and inputs. So with this, we conclude today's session of Facebook Live. We'll be back with another episode next week. Till then, take care, be safe.